I'm Joe DeMattos. I'm the President and CEO of the Health Facilities Association of Maryland. We are the largest, oldest nationally affiliated association of skilled nursing and post-acute care providers in Maryland. My family got to Hawaii in 1883, and I was very fortunate to graduate from the University of Hawaii at Manoa. In 2000, I was working for AARP in Hawaii doing their government relations and communications work. And in 2002, the COO of AARP Worldwide gave me a call. And he said, "You know, Joe, we've got the best lobbyists in the world, and we've got publications that reach 23 million households every 2 weeks. But what we don't have is somebody who can connect our lobbyists with our communications people and make a push in the national government for a prescription drug in Medicare." And so I came in 2002 to help coordinate that campaign for AARP, and I was extraordinarily blessed to be part of the team in 2003 when a drug benefit was finally put in Medicare for those covered by Medicare. Hawaii is unique, has been unique in the country in that we've had universal coverage there since 1974. Hawaii passed its universal coverage law in April of 1974. That sort of law was made illegal by the passage of ERISA on the federal level in the fall of 1974. And so really what Hawaii has done in terms of having a universal mandate for coverage, meaning people have to be covered for care and employers have to provide that care, has been in place since 1974. What we did in Maryland in 2006 in expanding access to Medicaid, and what ultimately the federal government with the passage of the Affordable Care Act in 2008 really does much of what Hawaii did back in 1974. What's common between the ACA and coverage in Hawaii is they both include mandates. Coverage must be provided. What's different about the national mandate is that it includes an employer mandate, an individual mandate, penalties for employers, penalties for individuals, but it also creates a marketplace through the exchanges. So it's much, much more complicated and robust than the Hawaii system, but you could sort of look at Hawaii's healthcare model as the grandparent of what eventually happened with the expansion of Medicaid in Maryland in 2006 and with the creation and the passage of the ACA in 2008. If you look at my involvement with healthcare or my professional career, there are three things that sort of interlock. One is a tremendous respect for our elders. In Hawaii, we call them kapuna, and those kapuna are even more valuable than the former ali'i, the former kings and queens of Hawaii. Kapuna are regal and they're to be treated that way. So I sort of grew up that way. Secondly, Hawaii does have this history of providing health care that dates all the way back to 1974. And it's not perfect. There's a lot of tension that's created in the marketplace when an employer is required to provide comprehensive health care, mostly at their cost, to an employee working 20 hours a week. So it hasn't been a perfect system. But in terms of access and providing quality care and reducing the healthcare spend, it has been instructive for the rest of the country. So I became involved in that very early on. And then the third part is education and linking sort of educational learnings just in the community and in the workplace relative to healthcare and the aging of America. Look, we have 10,000 boomers that are turning 65 every single day in this country. And that's going to be the case for the next 18 years. So it's a good time to be in healthcare.